we're hearing reports out from the US that in some areas the lockdown is starting to be relaxed. What is the current lockdown situation out there in California?
Okay, great question. So starting in March until about last week, May 15th, we had very strict stay-at-home orders, and only very essential businesses were open, including hospitals and banks and pharmacies and grocery stores and physician offices. Since May 15th, the stay-at-home orders have been completed. However, now we're opening up in phases, starting with the most essential services first.
Wow. And how has the lockdown and those restrictions affected the way that you practice? Because it's affecting pretty much every facet of our lives these days.
Sure, like many physicians and maternal fetal medicine physicians in the country, we reduced our services to essential visits only, which in pregnancy accounts for a lot of the visits actually. And then many other visits were, as possible, changed to virtual or telemedicine.
Mhm. So which examinations were you able to move over into a telemedicine scenario?
So a lot of our, first of all, consultations we had with patients in terms of, for example, their diabetes care, hypertension, some of the more chronic conditions that we were following, we were able to do those via telemedicine with the patient. Some of our genetics counseling, pre-pregnancy consultations, if patients had specific questions or concerns, instead of having them come to the office, those are all converted more to virtual or telemedicine consultations. In terms of ultrasound studies, a lot of practices we saw in maternal fetal medicine had the physicians either staying at home or certain parts of the medical center, and then having their sonographers do the ultrasounds in order to minimize exposure and, again, social distancing. And we also even saw that in the inpatient setting as well.
So how has Tricefy enabled you to shift over to more of a virtual care scenario?
Essentially, Trice acts as our electronic medical record. So I use it for, like I said, archiving all of our images get stored there as our PAC system. We upload all patient forms, including prescriptions, intake forms, financial forms, consents, referral forms, billing sheets, all get uploaded onto Trice. I also use it for documentation or a recording system. I use it for what we call adaptive reporting, where we have various different reports based on the visits. I use it for writing prescriptions, for doing billing, like I mentioned before, but I use the reporting system. I've adapted it to what I need to do in my practice, so including the actual report for the visit, the consultation note, the telemedicine note, prescriptions, billing, and any other sort of documentation, freehand notes that I need to do.